today I'm here to continue the important conversation we've had on this floor about the ongoing addiction crisis we face in this country. Over the past few years, I'm told I've now come to the floor 57 times to talk about addiction, and most usually it's been about opioids and the impact that opioids are having, tearing our families apart, devastating our communities. There is certainly an opioid epidemic in this country. That would be prescription drugs, fentanyl, and heroin. It's true, but we've also got to focus on the fact that we have a broader problem, and that's what I want to talk about today. And what can we do about it? Congress has actually done a lot in the last several years. When you look at what we have proposed here and actually passed, we've put new policies in place at the federal level for better prevention, better treatment programs, and better long-term recovery. We've also passed legislation to help stop some of these deadly drugs from coming into our country. That's helped somewhat. Those legislative initiatives here from the United States Senate, like the Comprehensive Addiction and Recovery Act, CARA, or like the 21st Century Cures Act or the STOP Act, are starting to work. Over $3 billion of additional funds have been appropriated by this Congress just in the last 3 years alone to ensure that we have the ability to push back against this epidemic. In my home state of Ohio, one of the states that's been hardest hit by this epidemic, we've received nearly $140 million from the CARA and Cures grants. This has gone toward stuff that's working: evidence-based prevention, innovative approaches to treatment and to getting people into treatment, closing some of the gaps in the continuum of prevention and treatment and recovery. A lot of people were falling between the cracks. Closing those gaps has made a big difference in my home state. And equipping our first responders with what they need and training them with the training that they need to be able to help push back. The good news is these programs are starting to work. Drug overdose deaths are still way too high, but for the first time in 8 years of increased overdose deaths every year, for the first time in 8 years, we're seeing a reduction in the overdose deaths. In my own state of Ohio, we've seen some pretty significant progress. We've had a 21% drop in our overdose deaths, finally, again, after 8 years of increases. This was the biggest drop in the nation from July 2017 through June 2018, according to the Center for Disease Control's National Center on Health Statistics. Nationally, again, after 8 years of increased deaths every year, we've seen a leveling out. In fact, a very modest downturn. Between 2017 and 2018, overdose deaths have fallen from 73,000 to about 71,000. In all, the overdose rate has dropped in 21 states. Overall, only about a 1% drop. So very modest, but a lot better than the alternative, which we'd seen for 8 years, which is increased deaths. As we begin to turn the tide on this opioid epidemic, I'm convinced that we would be doing even better if not for the influx of fentanyl. 4 or 5 years ago, fentanyl came to our country in a big way, almost entirely from China, almost always through our own United States Postal Service, believe it or not, and it's caused all kinds of havoc. It's the deadliest of all the drugs. When you look at the overdose deaths, the primary cause is now fentanyl. It's a synthetic drug 50 times more powerful than heroin. We are beginning to push back again, including our STOP Act, which has now been passed, which requires the post office to begin screening and stopping some of these packages from coming in. We'll do a better job, I think, in working with China. We've got some commitments from them. We hope they're going to follow through on them. But even as this limited progress is being made on the opioid front, we have a new growing danger. I've heard this over the past few years from law enforcement, from providers, from people on the front lines on the drug epidemic. They're seeing a resurgence of what's called psychostimulants. Mostly, it's pure, powerful methamphetamine from Mexico, crystal meth. In the last couple of months, I've heard from the people in the trenches all over Ohio about this. I've talked to community leaders in Knox County, treatment providers in Southeast Ohio, service providers in Columbus and the Adams Board in Adams and Lawrence and Scioto counties, the leadership of the Hamilton County Heroin Coalition, community leaders in law enforcement in Butler County and Dayton area, Dayton just last week. From all over the state, they all tell me the same thing, which is we're making some progress now on heroin, and that's good. We're making limited progress on keeping the fentanyl out. But we're spinning our wheels on combating particularly crystal meth, but also they're seeing a resurgence of cocaine, both of which are stimulants, both of which are causing a lot of havoc in those communities, in part because it leads to more violent behavior as a psychostimulant. They're having a devastating impact in my state. According to an October 2018 report from Ohio University, these stimulants, including meth, were found in just 9 overdose deaths in 2010. That number rose to 556 overdose deaths in 2017, the most recent data we have. That's an increase of about 6,000%. That same year, Ohio had more than 1,500 people die of cocaine overdose, almost 140% increase from the year before. But this problem isn't isolated to Ohio. According to the Centers for Disease Control and Prevention, deaths involving cocaine, crystal meth, and other psychostimulants have increased nationwide. Among the more than 70,000 drug overdose deaths in 2017, more than 23,000, or nearly a third, involved cocaine, meth, or both. Just from 2016 to 2017, that 1 year, from 2016 to 2017, death rates involving cocaine and crystal meth increased by approximately 33%. And increases occurred across all demographic groups and in all zip codes. In the case of meth in particular, usage rates have gone up as opioid rates have gone down. I'm told by experts this is for a few reasons. Some meth users initially turned to this drug to manage the heavy crashes that followed prolonged use of opioids, heroin, fentanyl, other opioids. And then they became just as addicted to meth as they had been to opioids. Others turned to meth because the drug is now stronger and cheaper than other options. By the way, the days of home chemists and one-pot meth labs in America are largely gone. Probably in your community you can remember 5 years ago, 10 years ago, 15 years ago, the meth labs in your community. You aren't hearing about those now. That's a good thing. The bad thing is that you're not hearing about it because the stuff coming in from Mexico is stronger, more powerful, less expensive. The super labs in Mexico, run by the drug cartels, are mass-producing this meth. It's powerful, it's deadly, it's low cost. I'm told by law enforcement in Columbus, Ohio, that crystal meth now costs less than marijuana on the streets of Columbus. Most of it, this crystal meth, pure crystal meth, enters the United States from Mexico in bulk at ports of entry along our southwest border, often hidden in cars and trucks. Our Customs and Border Protection officers stationed there, already stretched thin by the ongoing migration crisis, often don't have the resources to identify these smuggled shipments. The Interdict Act, which we passed here, is beginning to help by providing some technology, but frankly, we need research on better technology, and we need to provide more funding to ensure we can stop this deadly substance by identifying it at the border to keep it from coming in. According to U.S. Customs and Border Protection, the amount of methamphetamine seized at our ports of entry has soared from about 14,000 pounds in 2012 to 56,000 pounds in 2018. We've also seen a 38% increase in methamphetamine trafficking along the southern border just in the 1 year from 2017 to 2018. One troubling measurement is that the number of crystal meth submissions to the Ohio Bureau of Criminal Investigation's lab rose from about 2,000 in 2015 to over 12,000 in 2018. That's a 500% increase in my home state. This is an indication of how much of this is being detained, how much is being found by law enforcement and taken to these labs. As I've heard from folks all across Ohio, we're also seeing meth laced with other drugs, including fentanyl, including heroin sometimes, and sometimes cocaine. I'm told that the cartels sometimes do mix these drugs into methamphetamines to lower the costs of the final product, meaning that the users may be consuming dangerous opioids without realizing it. Others do so because they know fentanyl, this is the traffickers, they know fentanyl is incredibly addictive. So you may think it's one thing, but it's really another. Any street drug that you use is potentially deadly. Remember that. But we still don't have the full picture of how these drugs are being mixed together and then sold for consumption. Over the past few years, I've seen more reports in Ohio of individuals using cocaine. That, unknown to them, has been mixed with fentanyl. In the last month alone, at least 49 Ohioans in my hometown of Cincinnati, Ohio, have been killed by that deadly combination. And it's been hitting our African American communities particularly hard. Again, this highlights how the drug cartels sometimes try to hook users by cutting stimulants with addictive, deadly fentanyl, often with lethal outcomes. The bottom line is we've got to address the broader issue of addiction, not just the issue of individual drugs. We know that crystal meth and cocaine is increasing pretty dramatically. That's why we've got to continue our fight against opioid use, but also provide more flexibility to our communities. As a result, today I'm introducing new legislation designed to address the resurgence of crystal meth and cocaine into our communities. To date, the grants provided by the 21st Century Cures Act, these are grants that go directly back to the states, and the states determine how they are used in the local communities. These grants are called the State Opioid Response Grants. They've been used to increase access to naloxone, a miracle drug that reverses the effects of an overdose. It's also been used for longer-term addiction treatment and support services for opioids. But for all the good they've done, these grants can't be used effectively to combat the drug crisis beyond opioids, which ignores the new on-the-ground reality of addiction in my state and many others. So the legislation I'm introducing today will make a simple change to existing law. It will allow these state opioid response grant funds to be more flexible so they can be used for whatever the drug addiction problem is on the ground, which will be a little different for every state and, for that matter, for every community. In particular, dollars would be able to be used for programs focused on methamphetamine and cocaine treatment and recovery. We know that these existing funds are making a difference. We've got to be sure and keep this program going. That's why my legislation will also reauthorize the State Opioid Response Grant Program with this flexibility, but reauthorize it for 5 years, providing $500 million annually to ensure there is stable funding. A stable funding stream to these states is absolutely essential to have the predictability and the certainty we need to continue to make progress and to avoid these new drugs coming in and creating more devastation in our communities. It's a simple common sense change that will allow state and local organizations the flexibility they need to fight what's quickly becoming a two-front war on addiction. The fact that we're continuing to see these new types of drugs pop up in Ohio and around the country highlights the reality. This is a fight against addiction. Addiction is a disease. Again, this Congress has done an unprecedented amount of work in this area in the last few years, and I commend us for that, but we've got to do more. We've got to provide this flexibility. We've got to be sure that we are focusing on the fight against addiction, not just an individual drug. While I'm encouraged, again, by the welcome progress in preventing opioid overdose deaths, we cannot rest on our laurels. While the cartels continue to pump new combinations of opioids and stimulants into vulnerable communities, hooking individuals on yet another toxic drug and perpetrating this cycle of addiction. Let's keep our unprecedented bipartisan efforts going in this body. Let's continue to partner with our allies in local government, in state government, and with our nonprofits, and let's make sure the resources are there to continue to save lives and restore communities. I yield back.